Welcome to the Plant-Free MD podcast with Dr. Anthony Chafee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. All right, hello everyone. It's Dr. Anthony Chafee again here with another episode of the Plant-Free MD, and today I have a very special guest, my good friend Olivia Khwaja, who is one of the board members of the Public Health Commission in the UK, where I will be speaking at their annual conference over in Sheffield later on in the month. Olivia, thank you so much for coming on.
Thank you for having me.
Yeah, you're very welcome. So could you tell us a bit about yourself and what you do for people who don't know you?
Yeah, absolutely. So my background is very much outside of the nutritional world. I started my career in the business world. I was there for over 20 years, worked for a couple of big recognizable brands in the UK, and very much enjoyed it, loved all the challenge and the stimulation. But I did get to the point where I felt like I was getting pretty burned out by it. And it was a few years after having looked after my parents for about a decade, and they were both unfortunately passed away from a couple of diseases, Alzheimer's and type 2 diabetes between them. So it got to the point where I felt like I needed to take some time out of work for personal reasons and to get some perspective. And one of the things I thought I would do while I was off was to look into these diseases that I felt I had, I was inevitably going to get because they're hereditary. But I thought maybe I'd find something that would de-risk my chances of getting them, and thought I would find out what that was and maybe have a few more blueberries a week, or maybe I'd go plant-based, or who knows. But I was pretty open-minded about it, and I already was healthy, or what should I say, ate real food for the most part, but there was a lot of mixture of different macronutrients in there. So I was really surprised when I started investigating and researching and going onto YouTube, really looking not for weight loss necessarily, but just for how to prevent myself getting Alzheimer's, I think was what I Googled, to find out fairly quickly that there was quite a school of thought that none of that had to be inevitable, and that you can pretty much eliminate the risk, not just reduce it, by changing the way that you eat. And so I remember doing a run. I used to run every single day for 7 miles. And that's when I did a lot of my research. I remember sprint finishing on my run one day and hearing Dr. Eric Berg say the sentence, "Good luck burning fat if you've got sugar in your blood." And it really hit me like a ton of bricks, because I suddenly realized I totally misunderstood the concept of fat burning and how it worked. I thought it was all about how much you eat in the day, and there's someone calculating it sitting somewhere, and then you either lose weight or you don't. I thought, well, I've just had a massive smoothie before my run of oats and bananas, and is that why I don't lose weight? So this is all kind of coming together, and this realization of how the body worked, and so I decided to move onto a low carb ketogenic diet. I was very successful on that for a couple of years, and then over the last year I moved over to carnivore and had even more success with that, which has been really great. But yeah, it really hit me hard to know that these diseases that I guess, in a way I trusted that the right experts in the right places and the right authorities will have done the right research to have the confidence to tell people what the right way is to eat. And I trusted in that system. And it really, it really did frustrate me that I had to go through a period of my own research to actually find out that all of it was totally wrong. And coming from a corporate background, I couldn't really reconcile that, because in the corporate world you have very strict standards that you have to stick to. There's things that you also get away with, but when you've got responsibilities and you have to communicate things to the consumer, you have to communicate them, and there's no cutting corners. Whether it's terms and conditions or whatever it might be, you have to do what you have to do. And so it just felt like such a disparity of standards that on the one hand we're held up to such high standards in a kind of a corporate environment, and yet in the environment where the government's responsible for giving us dietary advice, that was so lacking in any real evidence, any real science. So So it felt like maybe I could use my skills, which were always in strategy and marketing as my background, towards this area of nutrition, which feels like it does need some help in trying to get these messages out. And, you know, it's not, unfortunately, not happening by anyone putting a huge amount of money into it right now. But luckily, we've been able to have organizations that are going to help move that forward. So yeah, I've decided to get involved in a charity that can help with that. And so I'm involved with the Public Health Collaboration, which is a great charity in the UK. It's helping people to understand more about diet and the right way to eat. So yeah, so that's what brought me to this point.
Hey guys, just want to take a second to thank our sponsor at Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. For those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right. Thanks, guys. Great. I think I said the Public Health Commission, didn't I? The Public Health Collaboration. If I misspoke, I apologize. Okay, so can you tell us a bit about PHC and what your guys' mission there is, and how you're trying to affect these changes?
Yeah, absolutely. So the Public Health Collaboration it just really exists to help people understand the significance of and the importance of their own metabolic health, and for them to be able to grasp these, and be empowered with the right tools and information to actually make the changes themselves and to feel empowered to take control of their own health. And it really comes from a message of eating real food and maintaining a diet where you are eradicating seed oils and synthetic substances of any kind, processed foods, and understanding that is your key to unlocking the kind of the worry of all of these diseases out there that you think are hereditary and you think are unrelated and could all stem from different parts of your body that are not speaking to each other, but actually it's not the case. And in a way, it's a really good message because it's a really simple concept to understand that your metabolic health is what underpins so many different diseases that you probably are worried about and that you've seen people suffer from. So it becomes more feasible to actually to have some control over de-risking yourself if there's just one solution to fixing that. So yeah, the Public Health Collaboration are very much about helping people to understand that message and to have the right tools and the right information to actually make those changes. And we very much interface with both the public, but also, and certainly more so in the past, we interface a lot with the healthcare community. We're made up of a number of doctors and scientists who set the organization up about 7 years ago, and who have spent a lot of time working within the healthcare community to make those changes. So you might know Dr. Unwin, who's reversed about, I think, 130 people's type 2 diabetes now in his own little GP practice in the north of England. Wow. And Jen Unwin, his wife, is a clinical psychologist who's pioneering the recognition of food addiction, being recognized by the World Health Organization, so that people can get the right support when they struggle to eat better. Because a lot of people try low carb and they say, oh, it wasn't for me because I needed to have whatever it is that I normally eat and it was too difficult. And a lot of the time that's a food addiction that needs dealing with, and people don't quite see it as an addiction, so they don't really know how to get the right support and recognize it. So yes, the Public Health Collaboration are doing a lot in that space as well. We have a lot of ongoing projects. So we have a project called the Lifestyle Club, which is a service we offer to our National Health Service, which allows GPs to refer those who are pre-diabetic or diabetic onto a program where they get full coaching and support over a number of weeks to help bring their diabetes back into remission. And that's a service that we that we are now scaling up. We've been piloting it, so that's a really great part of PHC as well. And the main event that we have each year is our annual conference, which we can talk about in a minute if you want. But that's kind of roughly what the PHC is all about in a nutshell, which is helping people with their metabolic health and helping them understand and take control of it.
Yeah, well, that's great. And so so primarily like a grassroots sort of movement, trying to get people educated and have them affect their own changes on their own life, but also working with care providers to have them work with their patients and then educate their patients outwardly like that. Is that right?
Absolutely, yeah. And most of the people who know about us right now are the healthcare community, because
Right.
so many of the people involved in the PHC, as I said, are doctors and scientists. So they've kind of reached out to their networks, and then more and more of their own healthcare kind of colleagues have come along and spread the word that way through the healthcare community. So whenever we do have events, it does tend to be a lot of healthcare community supporters that we have attend. And if you look on our social media, it's again a lot of healthcare community practitioners that are on there following us. So that's really, really great, because we really believe that the education is going to come by combining both the healthcare community and the public, because the public are really great at educating the healthcare community as well. Sometimes they don't want to be educated, but sometimes it's easier to hear it from the public. And I don't know if you ever heard Dr. Unwin's story, but the way that he came about realizing he'd been treating diabetes incorrectly was when a patient sat down and told him that she was unimpressed with the way that he'd recommended she goes about treating diabetes, and she was going to make a complaint about him. And so he got really worried about that, and he decided to sit up and pay attention.
Wow.
So sometimes that's the way it has to go, and that's the way round it goes. So we think we have to tackle both of those audiences, and they will in turn tackle each other when they interact. So yes, that's kind of where we've been, but I think where we're heading is much more towards directly speaking to the public. And that's why we are going to kind of use our conference as a platform for that, but also know that we have to use things like social media and talk to people directly and help them understand some of the messages that are coming through, you know, from these kind of leading edge doctors and scientists that is not making it into the mainstream right now. And I really think about it as, you know, someone from a consumer marketing background. There's been a you know, I try and sometimes estimate how long it's going to take to get this message out, because we have a huge disadvantage that we are not going to be funded. We don't make any profit, and we're not going to be gaining any contributions from any industry, because we're not helping anyone make a profit in anything. So the way that we have to spread a message is through all the free channels that are at our disposal. And I compare it sometimes to my previous role, where I was working for an energy company, and we had to get to every single adult in the UK, and we had to get them to understand a message, take it on board, change what they were doing, accept someone coming to their home to change a meter, and then change their behavior to reduce their energy consumption. And that was something we had to do for every single adult in the whole country. And we are only just about getting there. And it's been about 15 years and probably hundreds of millions of pounds of marketing spend. Like, we'd spend about at least coming up to maybe 80 to 100 a year across the industry, each supplier, a central campaign body. And and we had a deadline, so we just had to throw money at it. So, you know, if I think about that, you know, that the challenge of how many people we're trying to reach is no different here. And maybe it's a bit more because we've got kids as well. And we're asking them to do the same things. We're asking people to take on a message and change what they do in their lives. Maybe we've got a slight advantage that maybe people are a bit more interested in nutrition than they are in, you know, their energy supply. Maybe that's good, but still, you know, you've also got addictive foods pulling them in the other direction. So I don't know if that actually nets out as a benefit necessarily, but it still would take, I would see it as a problem that would cost hundreds of millions of pounds to grasp, and at least 10 to 15 years. And if that's the benchmark, then we are very much in a space where we've got quite the challenge to reach the public, and not least also because they will be getting information in the opposite direction from the industries that will be trying to pull them into all kinds of more exciting and exhilarating products that will feed their addictions. So I can't quite underestimate how large a challenge this is, and it's something that will have to take effect. But I think what's really positive about it is that there are so many experts out there, and what you're hearing via the internet these days is so different to any other period in history where you could get access to this kind of information. And there's a real power in that, because unlike marketing is always, it comes across as a sales message, and so people tend to ignore it. Whereas when you're listening to someone that you believe in, and when you listen to someone that is telling you, doesn't have an interest in profiting from what they tell you, then that message cuts through much more easily to people. They take it on, they believe it, and they can make change as well. So that's definitely, I'd say, in the favor of everyone in the space that's trying to raise this message. But as I said, you can't overestimate the challenge and the uphill struggle that it's going to be to get to everyone. But I'm really hopeful, and the quicker that we can get up the curve, the more people will help sooner, and the less suffering there will be. But I kind of think of it as an adoption curve, where you have, I don't know if you know, the kind of innovators, early adopters, early majority, late majority, and the laggards is what you call them at the end. And the curve normally have the innovators, there at the start. And I sometimes think of them in this context as, those that have the worst health issues, that have had to come to some solution to try, and they're trying anything and everything so that they can actually solve their health problem. And they've ended up probably becoming the biggest advocates and proponents early on, because they've had this huge change in their life, and they're so excited about it, and they want to tell everyone about it. And so they're the kind of the beginning of the curve. And then you've got those that are kind of the early majority, who are or early adopters, who will be probably those who are, I don't know, interested in, not necessarily needing to do the diet, but interested in fitness and health and performance, a bit like maybe yourself, Sean Baker. Others have come to it for that reason. I certainly did as well. And they'll be kind of these early adopters. But then the quicker we can get through those chunks of the curve, the quicker you'll get into that early majority. And so it's going to be a case of how quickly can we get up that curve, because you don't want the curve to be long and flat. You want it to be as quick as possible. Otherwise, you're dragging the whole thing out. You're more people suffering, more people are paying for healthcare that doesn't need to happen. So that's kind of how I look at the problem. And I think it is a challenge that not just PHC, but all of us face, which is it's a big ask, but I'm still really hopeful we can get there.
Yeah. And, when you put it like that, that we have to reach absolutely everyone. And the energy companies spend, hundreds of millions of pounds trying to do that. And it's still not quite there. It's a very daunting task. And not only are we trying to get everyone in England, we're trying to get everyone in the world. So it's even bigger. Thankfully, the message sort of sells itself. When people start doing it and they see the results, people, want to emulate those results a lot of the time. And they see their friends and their family doing this, and they're getting better, and then other loved ones are getting better. And so they decide they can try it. And so thankfully that has been in our favor. And, I'm hoping that we can just start getting a little more public awareness, and if we can get into sort of mainstream media sort of circles, even people trying to tear us down and try to take us on so they can debate us and thrash us, well, at least it gives us an opportunity to defend the case. And at least it has to be out there, it has to be discussed. So yeah. Sorry, go on.
So no publicity is bad publicity.
Yeah, exactly. So are you guys trying to target politicians and bureaucrats and things like that to try to change, like from a top-down policy sort of approach as well?
Yeah, I mean, it's definitely in our scope to do that, and we have certainly attempted to do that over various phases in the past. David Unwin has met with the Health Secretary of the UK and shown him his results, but it hasn't really resulted in any real change.
Right.
And we ask ourselves the question about why that is, because when you're handing it to, especially a public healthcare system, which should be interested in bringing its costs down, which isn't trying to turn a profit necessarily, you would think that they would be looking to grab onto any opportunities to bring the cost down.
Mm-hmm.
David Unwin worked out that just if every GP practice in the whole of the UK was to prescribe drugs as he does, we would reduce costs by £270 million. And that's really quite a conservative number.
Mm-hmm.
And if you also look at the numbers, for the total numbers, like the NHS spends £10 billion a year on type 2 diabetes. It's by far the largest chunk of the budget.
Yeah.
About 7 billion on cardiovascular disease, 5 billion on cancer. So all of these costs mount up, and the taxpayer is paying for them every single month. So you would think that even if the government wasn't thinking that it would stimulate the economy to bring these costs down, at least they would have some other priority that they're probably needing to direct the money on. There would be some reason why they would jump at the chance. But we have definitely made this information publicly available, and at the moment no one is really using it in any concerted way. And we really believe that we've done as much as we can pushing upwards, and we'll still do as much as we can, but we think that the only way to get the top to topple is to get the bottom to create that upward pressure, because until they have a reason to do it, until someone is harassing them and saying we've got to bring this, until there's some kind of pressure on them, they won't necessarily make a change. So we also see that the policymakers are actually pushing back policy changes that were due to come into play this year, which was going to change the labeling on processed food to make it more obvious which were the least healthy. That's all been pushed back because of the cost of living crisis, because they don't want to put people off the cheapest food available, which is obviously a really short-sighted way of looking at the problem, because people are just going to continue to eat the worst food, and it will cost us more to treat them when they get to the point of sickness. So we think the change has to come from the bottom. We don't have faith in the top doing its own job all by itself. So we're now redirecting, shall I say, all our energy and efforts to the grassroots movement.
Okay. Yeah, I think that's probably the only way to go. You have to, politicians really don't pay attention unless, it's going to cost them if they don't. And either in support money and funding for their next campaign, or just in their constituency being pretty upset with them. So I guess that's what we have to focus on. So speaking of which, the conference that we have going on next month, that's the annual conference that you guys put on every year. How many have you had so far, and what do you guys try to achieve with these conferences?
Yeah, so we've had 7 so far. We've been in operation 7 years. We've had 7 conferences, even through COVID. Some of them were virtual. But what we try and achieve is very much in line with the overall objectives we have, which is to help people understand this concept of metabolic health. We've generally been very focused on type 2 diabetes, because we've had Dr. Unwin being part of the organization. And so we always cover that topic. But this year we are covering topics that we haven't covered before, which is really exciting. We've never covered cancer. We've never covered Alzheimer's and their links to metabolism. So we're really excited to introduce those topics. We're covering food addiction, and we are also starting to look at some of the related areas, I say. So the effect on the environment of eating beef, which will be an interesting panel discussion on the second day. and also the discussion about whether, what role plants play in the diet, which obviously you're going to be involved in. We're very excited to welcome you along for that.
Thank you.
So quite a range of topics, but very much, under the theme of this is how we fix the NHS, because we really believe all those numbers that I mentioned earlier that we're all paying for at the moment, people don't quite recognize that those numbers don't have to exist, and we don't have to be paying for all of that. And 80% of what the NHS treats are preventable illnesses. So rather than having a conversation, as we do all the time in this country, about how we're going to support the NHS, how we're going to fix the NHS, how, which political party that's coming up for election is going to put more money into the NHS. These are the conversations that we're having. And also, when are people going to start paying for the NHS? That's definitely becoming a more current topic as well. So it's all going in that direction, and no one is having the conversation about, well, do we need to pay all those costs for the NHS? Is there not more we can do to bring those costs down? And who's looking at that? And what is the strategy for that? And so we're trying to use the conference this year, and the theme of it is, this is how we fix the NHS, so that we can tie into this public discourse that's happening right now about the NHS to say, well, look here, we've found all these numbers and all these different opportunities, which are all connected to people doing pretty much one thing. And we'll start to bring these costs down, but you have to change the way that you approach medicine, and you have to start to look at it as a preventative lifestyle approach. And a lot of the time, it's not necessarily anyone that has to do it apart from the public. So if the public start doing this themselves, we don't have to have authorities telling them to do it. They can take a hold of it, and they can run with it, and they can be empowered, and they can make these changes. So again, it all comes back to, if we can get to grassroots, everything else just unlocks itself. So that's very much what we're aiming to do at the conference this year, is to make that message really clear for everyone coming along, and everyone who is going to be able to watch online. So we're going to be launching live stream tickets tomorrow, and yeah, we're very excited about people joining us from all over the world.
Yeah, great. Well, I'm definitely looking forward to it. I think it'll be very interesting. There's a lot of great people there that I'm really interested in meeting and seeing, and hearing their talks, like Dr. Unwin, Sean Baker, diet doctor, who will also be on the panel with us, and Dr. Sophia Clemens from her institute in Hungary. I forget the Paleomedicina. And Professor Ben Bickman and things like that, and many, many more. Yeah, I've long thought about that side of the equation, of how much money we're spending. It's not, everyone says, oh, well, we need this system or that system in America. It's very topical for the last few decades about, well, maybe we should go to an NHS type of system to help pay for these sorts of things. But I think that's missing what the problem is. If you sort of focus on the wrong problem, you're not going to get a workable solution. And the NHS has its problems, the US has its problems, all the systems have their problems. There's no perfect system, but the growing problem and concern that has been rearing its head in the recent decades is the fact that costs are going up and up and up and up and up and up and up extraordinarily fast. And so one of those major problems is, well, you can do things more efficiently, and certainly there are things about waste and all that sort of stuff. But I think a major problem is exactly what you're saying, these preventable diseases that aren't diseases, they're just toxicities. We're poisoning ourselves with the things that we're eating, and we're getting the results of that. But in America, 9% of adults are diabetic. And that accounts for 75% of the Medicare costs in America. And 40% of Americans are pre-diabetic, meaning that ostensibly, if they don't change what they're doing, and if we don't get this out there, to enough people, then there's no reason to suspect they will. Within a decade or so, we might have as many as 50% of Americans being diabetic. What's that going to do to the healthcare costs? So I think that's a major problem there. Then you look at the fact that the sugar industry makes about $1.3 trillion a year, and but we spend about $2.4 trillion a year treating the medical effect of the medical ramifications of sugar consumption, not even all the rest of it, but just sugar consumption. So that's, call it $4 billion, close to $4 billion or $4 trillion, I'm sorry, that you are just having there that's just locked away, that's not being used and utilized in more useful ways and is being wasted. People talk about defense budgets and things like that, but $2.4 trillion is triple the United States federal defense budget. So that's massive. And so that's the real healthcare crisis. That's what's really plaguing our system and crashing any system you care to make. It will destroy it because it's just untenable. We're spending too much money on these things that don't need to exist. Now you have this problem. There are medications that help. I think, yes, it's great to use those medications if you need them while you need them. However, if you can do something that's been clinically proven to remove your need for the medication and get you healthy without medication, why wouldn't we do that? And type 2 diabetes has been clinically proven by Professor Finney and others to be reversible if you just go on a ketogenic diet. And so, that's a massive, massive, massive benefit. You're talking about bringing back trillions of dollars. You're not going to be eating as much sugar. We're not going to be consuming over 150 pounds of sugar per person per year, which is the average right now. And you're not going to be needing all the healthcare medications, hospitalizations, foot amputations, vascular surgery and stents and all the other things for heart disease and stroke and cancer and all these other things that come along with it for the ride. So, this is something that we can absolutely overhaul and just change overnight, seemingly, if enough people know about it.
And I was a bit horrified to learn the other day that the 10 billion pounds I mentioned that is spent on type 2 diabetes in the UK, 8 billion of it is, because I thought most of that was probably drugs, but 8 billion of it is on surgeries. And that's depressing. I mean, it includes eye surgeries and cataracts, that kind of thing, but it also will include amputations. So we are just in the wrong, we've got the balance totally skewed in the wrong way. And even Professor Ben Bickman was saying last night that the metformin drug that's given out as one of the first drugs for type 2 diabetes and is seen as one of the better drugs in general he's been reading some studies about how it totally disrupts your mitochondria and undoes any benefit related to exercise. And it's some new study that's out that he thinks is really interesting, and he was mentioning too. So even the best drugs that we're giving out they're never going to be doing anything that's a net positive, I don't think. There'll always be some cost to it. And I think the way that the NHS approach reducing costs it's just so it's very kind of lost in the weeds. I was hearing about how when we talk to the right people in the NHS and say, well, what are you doing to bring costs down? The way they look at it is, well, we have so many amputations to do a year. We're going to go and find out how we can reduce the cost of all the instruments that you need to do amputations and therefore, get a better deal in the supply chain and negotiate. But that's how they look at cost reduction, not get rid of the problem, just bring the cost down of the problem. So it really does take people aback when we say some of this stuff, because no one's thought about it. And so, but I guess that lends itself to there being a huge opportunity here. We just have to get this message through.
Yeah, I totally agree. Great. Well, thank you very much. I think that the conferences are going to be, I think, very educational for people. Hopefully, people like it. Is it something that people have to see in person, or is it going to be put up on the internet, or people would be able to join virtually or anything like that?
Yeah, I was saying so. You can absolutely, if you're in the UK, please come along. It's the best way to support us, and it's in Sheffield on the 19th and 20th of May. And we have a fantastic lineup, which you can see at phcuk.org/conference. I'm sure you put it in the notes. And if you can't make it along, we are also going to be offering a live streaming option. So I know that many people are going to be interested in seeing the plants discussion, and there's certainly a lot of discussion about that discussion online. And many people from the US, for example, will be wanting to virtually stream in. So we're going to be offering that option, and it launches tomorrow. And so that's exciting. And so hopefully we'll get lots of people tuning in to watch your debate, Anthony. And yeah, so and then after that, in a little while, we'll then release all the talks onto YouTube. And if anyone looks at our YouTube channel now, they'll see all the talks from all the previous conferences that we have done, and some great people on there, Jason Fung, many others, talking about all of this. So check us out, and please subscribe to our YouTube channel, because there's great content coming up all the time there now.
Great. Sounds good. All right. Well, definitely put all of that in the show notes, and everyone who is able to attend, please do. I'd love to see all you lovely people there. And if not, then hopefully you can catch the replay or the live cast online and then on YouTube. So great. Well, Olivia, thank you very much. Great to see you as always. And I will see you in Sheffield.
See you there.
Okay. See ya. Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.